Hi thinkers, it's Tex here with Thinking Moms Revolution's Thinking Out Loud. And throw your hands up, because today is an exciting day, exciting episode of Thinking Moms Revolution, because today I get to interview one of my heroes, Sym Rankin. Oh, wait, I'm going to tell you who she is, but I gotta, hang on, get my notes. I'm going to read this. I'm going to read it so I don't get it wrong. Sym Rankin is a graduate of the University of South Louisiana and the Charity Hospital School of Nurse Anesthesia. As a practicing anesthetist, I hope I said that right, a practicing anesthetist of over 30 years, she's witnessed an alarming increase in chronic and autoimmune disorders, as have many people. These observations became personal when her own son was diagnosed with autism. So Sym is an autism mom, and she is an nurse anesthetist. Oh, and an amazing person. My own story is that my own story, which you can read about in the book, The Thinking Moms Revolution, on page 175. And it's a good chapter. It's written like a stage play. So get the book and read it. My own story, my son seemed to regress after anesthesia, after a surgery. When he was 12 months old, he lost words, he lost eye contact, we had constipation, we had GI issues, he tantrumed, he cried for weeks on end and never came back out of it, and later was diagnosed with autism. So with Sym's advice, he had another surgery a couple years ago. He's now 8, so when he was around 6-ish, he had another surgery and came out of it with flying colors, with no constipation and no regression and no craziness. And so we're going to talk about why that happens and other things. I know a lot of you have questions. My timeline and my inbox on Facebook have been blowing up this week because so many of you have concerns around this topic. So we're going to talk about this and so much more with Sym Rankin. So throw your hands up. Throw your hands. Are y'all feeling me? No. Okay. All right. Okay. Ladies and gentlemen, Sym Rankin. Yay! Okay, everybody. She's here. Sym Rankin. She is a nurse anesthetist. Did I say that right, Sym?
No, anesthetist.
Anesthetist. Let's all say it together. Anesthetist. That's a new word for me, Sym. I'm not very good with that. I'm going to say that a few times and get my, like a tongue twister. Whatever you are fantastic. You have been, for me, an inspiration and in ways a mentor. When my son had to go under a couple years ago, I was worried because he had regressed, I thought, after his first surgery, and so you gave me some fantastic help and advice about how to talk to my doctor. And this issue is becoming bigger and bigger all the time. I'm hearing more and more people asking questions and concerned about how to talk to their doctors about anesthesia and autism and all that. Okay, so I'm just rambling. I'm too excited that you're here. Yay, Sym Rankin. Okay, so let's talk. Sym, talk to me a little bit about what the concerns are that parents have and why these concerns are valid, what studies are out there, all that stuff.
Okay, I don't know if you guys remember, a couple of years ago, they had a study came out and it said that kids who had one or more anesthetics during that critical period of development developed developmental disabilities. So, when you really kind of look at that study, it kind of threw up some red flags of, what's really going on.
Which study was that, Sym? Was that the Mayo Clinic?
Yeah, that was the Mayo study. You have to realize this is a really great study. In 1984, they started this study, and they followed these kids for over 20 years. It's a great database that they're extrapolating a lot of studies from. So what this study showed is that kids who were exposed to 2 or more anesthetics had an increased incidence of developmental delay. So you have to kind of go back and realize, what was happening in 1984. So, I started practicing in 1983. And the only thing we had in our toolbox for kids back then was halothane and nitrous oxide. Halothane was the only gas we had for kids, and it was a very toxic gas. Back in those days, you used to stay in the hospital a day or two after surgery. It wasn't metabolized out very quickly. So, and then on top of that, because it was so toxic, we gave nitrous for what they call a second gas effect, so we could use less of the halothane. So what were we doing? We were given a very toxic substance, and then we gave lots of nitrous, and we all know what nitrous does. There's studies out on that say that.
Well, not everybody does know what nitrous does. So
well,
just quickly.
Right, nitrous depletes your B12, okay? And you need B12 in that methylation pathway, B6, B12, folic acid, so you don't build up homocysteine, so you can go down that pathway to make what? Glutathione, which is the major antioxidant of the liver.
And that helps us methylate and detox.
Right. Glutathione grabs onto toxic substances and gets them out of your body.
And there are toxic substances in anesthesia?
Well, it's a chemical. It's a chemical. It's a chemical. So basically, we were giving. So step back and look at and see what was happening back then. We were given a very toxic substance, and then we were basically kind of destroying the way to get it out of your body because we depleted B12, and you could not methylate. And then what did you have? You get oxidative stress, low glutathione, and therefore developmental delays. In my opinion, this is kind of like the anesthesiologist just did a study to prove what's going on with our kids. So you have to realize back then in 1984, we didn't have as many toxic substances being exposed to these kids now that we have now. Fast forward,
the increased vaccine schedule, right, and GMOs and lots more antibiotics and
lots more
parents on SSRIs and
We all have our stories. We all have our stories of like that perfect what is really going on with our kids? What made our kids go into this horrible thing? Everybody has their stories. Antibiotics during labor, the hepatitis B on the day of birth.
Sure. For me, it's very personal when
infection, antibiotics, and toxic exposures, and we just don't know. And we all have our story of what tips our kids over.
Yeah. So for me, it's very personal because I believe anesthesia was his tip. He did have a few very, very, very 3 vaccines, which may have probably did contribute, and then the anesthesia. And it makes so much sense when you're talking about this, how the body detoxes and the liver and the glutathione and the methylation. Oh, well, yeah, okay, Talia, you're not so crazy because in 2008, Columbia University came out with that study that said kids who have anesthesia under the age of 3 are double the risk for developmental delays. So we have the Mayo Clinic saying if you have 2 or more times under as a kid, your risk are increased, and we have Columbia University saying if you're really, really tiny and you're getting anesthesia, there's some increase there too. Okay, so we know that there's some dangers, that we need to be aware of.
You just got to step back and realize that it's drugs or chemicals, and it's a chemical exposure that our kid has to go through. Then right. You have to kind of go back and say, if there's a necessity for surgery, you've got to have surgery.
Oh gosh, yes, right? Let's make that clear right now.
Got to have anesthesia to prevent that sympathetic response.
Yes, let's say that out loud right now. If your kid needs surgery, you got to have surgery, okay? We're not saying don't have surgery. We want your kids to have the medical procedures that are necessary, right? We're saying
now,
that.
Out of this whole study, they came, the anesthesia community is studying this. There's a thing called Smart Tots. It's a kind of a public-private association that they are looking at and doing studies on early exposure to anesthetics in the community. So they are doing this.
So all that's in the works. And Sym, at some point, it won't be this week, we know that, but at some point, probably in the next couple weeks, we'll be able to put up your slides, your PDF that goes through all of this.
Up with reference to some studies and things like that we talk about.
Okay. So we'll have all that up for people at some point with links and studies and all of that. But what we want to get to now is what can parents do? So we have a child with either very young or with autism or some other kind of related disorder, autoimmune disorder or whatever, what have you, and this child needs to go under. How's the best way to navigate this?
Okay, well, the thing is that you have to realize that the anesthesia personnel, they're the experts, okay? And you can't go in there and say, don't give this, don't give this, don't give this, don't give this. It's kind of like the same thing. All of us have previous lives when if we worked in marketing or whatever we worked in, and some client came to you and said, do this, 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 you're the expert. So you have to kind of learn how to talk to them and explain to them what your concerns are and what your problems are with your kid, your medical problems. We have a basic disconnect with anesthesiologists, the same way the same disconnect we have with any other doctor that we have to bring our kids to. They read what they read in the media, that our kids are mentally ill, that they're,
it's a behavior disorder, they're born with it, nobody understands why.
Right.
Okay.
Nobody really kind of understands the problem, and I don't want everybody to get labeled crazy mom, so we have to go in there and realize that, try to have a conversation with the doctor and explain to them. Don't use the A word so much. I say let's use the designer labels in a way. Explain that your kids have methylation problems and mitochondrial problems. I mean, we have tests that prove this. A lot of kids have low B12 and they have folate problems. Dr. Rossignol's and Dr. Fry's work in mitochondrial dysfunction and autism. I mean, there's study after study out there that show them that our kids are sick. So they may be true mitochondrial disease, but they do have a dysfunction, and those same things that you worry about in any kind of mitochondrial dysfunction, you have, there's anesthetic considerations for that. You have to kind of get them to understand that our kids have mitochondrial dysfunction. They have methylation problems, that our kids have, our other kids have gut problems, that they can't absorb those nutrients that go into these metabolic pathways. So we have to kind of get them to understand that our kids are physically ill and that they have these metabolic problems that have to be taken into consideration when we give them an anesthetic.
Okay, so mommy has her little Johnny, and little Johnny needs dental surgery and has to go under, and now we are calling the doctor. In my case, after I spoke to you, I asked to speak directly to the anesthesiologist, and I said, and I was kind of under the wire. I said, he's got a B12 deficiency and a mitochondrial disorder and some food allergies, and he's allergic to Tylenol, and I kind of just said these things, and she was able to work with me, and it worked out well for us this second time around. Now, I guess I'm wondering, parents that maybe haven't had all these tests done and aren't sure,
Mm-hmm.
I don't want to say tell them that anyway, but I kind of want to say,
Right.
tell them all that stuff anyway.
When you really look at our kids, I mean, they're sick. A lot of them are sick. When you present to a hospital for something, obviously the kids are sick. So, you can look at a child and a kid who has hypotonia. I mean, that's a mitochondrial dysfunction. There's a lot of things out there. A lot of Jill James's papers have kids who have autism have 80% reduction in glutathione. You can, kind of explain that to them.
Okay, but aside from the nitrous, because we talked about nitrous B12 deficiency and these other things, because usually it's not just nitrous, they're giving something else in addition
Right.
to. So these other things that are being given also, all of them, because they are all chemicals, there's going to be some issue there with detox or methylation or whatever.
Right.
Right?
Well, yeah. So the best thing to do is, we've all heard stories, okay? And I'll tell you two stories. And one of these stories was put on the blog, and I have the permission of the mom to kind of talk about this, is that her child has had multiple anesthetics, basically just to remove stuff from the ear. It's a very simple procedure. And, one of the moms wrote about this on the blog, and every time, it's a 5-minute procedure, every time that they would go to the hospital, and this is an older child who weighs a lot more, she would sleep for 6-8 hours after. Okay, so this time when the mom went, she told them, look, I have a kid who sleeps 6 hours after. Can we keep it simple? She's got mitochondrial problems. She's got she's got methylation problems. And the anesthesia person got very upset and said, I'm not doing this. And unfortunately, luckily, they went to, went to the head of the department, and they called him back and apologized, and they understood that yes, you have these valid concerns. Your kid is sick with these metabolic problems, and they just did it very simply, and the child did 100% better than she did with the previous anesthetics. So it's the point of trying to you have to be careful in how you talk to the doctors about this.
Okay, now we're walking eggshells here. Let's just admit this, because we don't want to come out on here on the internet and say this one is more dangerous than that one or whatever. Right. We want to leave that up to the experts, the anesthesiologists, and the I'm drooling. See what you do? I just ugh, my mouth. Yay, Sym. Okay, so we don't want to go into the anesthesiologist and the anesthetist. What's the word again? What are you again? Say it again. Anesthetist. We don't want to go up to these people and say, I don't want this, I want that. We don't want to bombard them because then you're crazy mom and you don't know what you're talking about, and you research on the internet.
So they're the expert, and the most important thing that's to them, they're worried about the safety of your child.
Sure, absolutely. They're worried about the safety of your child. We're worried about the safety of our children. So I guess what I'm getting to is though we're not telling you people on this interview which ones to ask for or not ask for, okay? Right. But we can say nitrous, a long period of nitrous, not so great, right, for these kids because of the B12 thing. We can say lactated ringers. What is a lactated ringer?
Let's kind of step back a little bit. There are studies out in anesthesia in the pediatric anesthesia community. Victor Baum came out with a study is laughing gas. Nitrous is no laughing matter. Okay, you can easily get this article. It was published, I think, in 2004 or 5. It was presented at a pediatric anesthesia meeting. There's another study out there that's very easily to get, is why propofol is problematic. Okay, and that has to do with the mitochondria dysfunction that our kids have. So there's studies out there that are looking at this problem of this thing. The problem that we have is that we have to explain to the anesthesiologist that our kids who have autism have these problems. Okay, so that's what we have to do. So there are studies out there, and we'll put those studies up on the board. But there's not a lot of studies who are looking at anesthesia and autism. About 2 years ago, they came out with a study that said there's nobody looking at anesthesia and autism. Okay.
Right.
So, and that's the reason why, is that because, they still think autism is a mental disease. We don't know what it's from. So, I really think that, doctors and even anesthesiologists, they are being presented with an inordinate amount of kids that are so sick.
Right.
And a lot of them out there really want to do well, and they want to listen to you. So, what I want to try to do is try to help you guys kind of navigate that, so your kids can have a good outcome. Okay. Sure. So when we look at when you want to talk to your doctor, you've got to explain to them that, hey, my kid is very sick. Okay. My kid has some mitochondrial dysfunction. And then, when you look at mitochondrial dysfunction, there's articles. I read one in my journal, my anesthetist journal last week, that people who have mitochondrial dysfunction, you want to use, do an early morning case. You want to use lactated ringers with them. You don't want to use the high dose of propofol.
Did you say you do want to use lactated ringers with them?
I'm sorry, you don't want to use lactated.
You don't want to use lactated ringers. Okay. What is a lactated ringer?
Lactated ringers has lactate in it. So what happens in mitochondrial dysfunction in our kids have lactate and pyruvate levels that are high. They have their carnitine panels that are abnormal. So what feeds that mitochondria is the breakdown of those fats, and propofol is a phospholipid, so it's a very fatty thing. So what happens if you get too much lactate, you can't break down that fat, you get acidotic. So what feeds the mitochondria, what feeds that Krebs cycle, is the breakdown of fats. Our kids are low in carnitine, and unfortunately propofol is a phospholipid which contains fat. So you have to break down these fats. And if you don't have enough carnitine to break down these fats, you're going to cause some problems in that Krebs cycle and cause problems in energy to make, for your cells to make energy, which is what the whole mitochondria is. So I'll go back and we'll talk about what happened to another friend of mine who went into the hospital. She had an older child who had to go undergo an MRI. And I told her, you have to tell them, please be careful with the dose of propofol because he's got mitochondrial dysfunction. Well, she forgot to tell the doctor that. She told the doctor, no nitrous, no nitrous, no nitrous. The child had a MRI, and an MRI lasts about an hour, and the child was given propofol. Then the next day, about 2 or 3 days later, he had another MRI, which he was given more propofol. So the child went home after the anesthetic and laid around weak for almost 2 weeks. I mean, just was very lethargic. Okay, so we basically sapped away his energy by giving him those 2 big doses of propofol. Okay, so it's kind of like you have to look at the risk versus the benefit, and for a long procedure like that, the doctor wasn't aware that 2 big doses of propofol, because this kid has mitochondrial dysfunction. Okay, do you understand what I'm saying? So yes. This is what this disconnect is, and this is what the anesthesiologists don't understand.
Well, what about
they don't understand that when our kids, they wake up, they go home, and they look fine, but then a lot of our children go home and they regress, or they lose words, or they are very weak like this one was, or they sleep for hours. And some, this is what they don't understand, that, it's when we go under anesthesia, it is a chemical exposure, but it's a necessary chemical exposure. We cannot do anesthesia without giving our kids drugs.
Well, it's a necessary chemical exposure when the surgery is necessary. So the first question the parent needs to ask is the surgery really necessary? Because honestly, my son's wasn't.
Right,
and that's saying. Saying,
and
that's the first
that's something you have to talk with your doctors.
Right, that's a personal thing. Yeah.
So, okay. So that's the problem. That's what the problem is, and that's what we have to kind of get the anesthesiologist to understand. That when you see them, they wake up, they look fine to you, but we go home and we hear story after story. I mean, both of us have heard many stories of these kids undergoing anesthesia.
We're getting a lot of stories,
and that's why everybody's concerned. Okay. So we have to go in there and try to get the anesthesiologist to understand that.
So, Sym, what about parents who have little ones, little babies even? I'm hearing, one mom contacting me, she's got a 4-month-old, This kid, she's not going to be able to say, oh, the kid has a B12 deficiency and a mitochondrial disorder. I mean, there's no way that she would know that right now.
I really think, but the thing is that what you have to realize is that the anesthesia community understands this. I mean, all this stuff that was out in 2011 on early exposure to anesthesia causing learning disabilities, and then the next year, all that stuff that was in the media on early anesthetics causing ADHD, they understand that, okay? And anesthesiologists are probably taking that path of least resistance. There's articles out that just came out about polypharmacy and children. That kids present to the hospitals and we give them all these drugs and we really don't understand the side effects of all these drugs. There's studies out there that show that. So, with the Smart Tots initiative, this is in our under our radar now. So
you feel like right now
understand that parents are going to be concerned, even if they don't. Parents present to the parents who present to the operating rooms who don't have kids with autism. Right. They know that these parents are concerned because of the media, because of this study that came out in 2005, the whole study that came out that showed the kids who underwent anesthetics. So I think that anesthesiologists are more keenly aware, and they're going to take the path of least resistance and use less drugs on these kids and use what's only necessary. So what do you tell the anesthesiologist, right?
That's my question. Like, I've got a 4-month-old going into surgery. Is it okay to say my family has a history of?
Right. So and it's okay to tell them that. So anybody who presents, even from our community or from parents who have young ones who have to go under anesthetics, and it's a concern. You have to, you cannot. If you have to have a procedure, you've got to have anesthetics.
Sure.
Okay, there's a lot of newer anesthetics out there that don't have all the bad side effects, that don't have all, we don't use halothane anymore. We use a gas called sevoflurane that is not metabolized, that doesn't get into your fat and stick around forever. It's 2 to 5% metabolized. It's much, safer to go under that anesthetic than go under halothane like we did years and years ago. So, the anesthesia community understands what's going on with our kids and parents. Not only they're going to present and say, look, I am very concerned about this. So you go and you tell them, look, I'm concerned about these studies that have come out. Can we keep the anesthetic as simple as possible? I'm concerned, if you have, especially if people in our community present to them, say, look, I've got a kid with mitochondrial dysfunction.
Or there's a family history.
So I got a kid who doesn't detox well. So what you have to do is that you have to look at that. He has to look at the anesthetics that he's going to use and look at the risk versus the benefit. So if you've got a kid who's got to have a dental procedure and he's got to have a tooth removed, okay, and you know what nitrous does. Okay, you kind of have to look at the risk versus benefit. Is it easier to go into the dentist and have them give 5 or 10 minutes of nitrous and put the Xylocaine in and have them pull it real fast, or put them into the hospital and have a general anesthetic with more chemicals? Do you understand what I mean? With more drugs. Exactly, so you have to kind of look at that, at the risk versus the benefit of any kind of procedure that you undergo. Okay, a lot of these questions you get about dental anesthetics. Okay, we know what nitrous does. We know that it depletes your B12. So if you have to just get a simple tooth pulled, is it easier just to go and get that nitrous for 15 minutes instead of admitting them to the hospital and undergoing an anesthetic without nitrous?
Sure. And would prepping
risk. So you have to kind of you have to talk with your doctor, you have to talk with your anesthesiologist, and look at the risk versus benefit of each one. As they say, it's the dose. The anesthesiologist may feel more comfortable using a little bit of nitrous to do the inhalation anesthetic at the beginning. If you have a child that you're concerned about their airway, you want to get them to sleep fast. So the nitrous will get that SIBO in a lot faster. 3 or 4 minutes of nitrous until you secure the airway, then you turn it off, is much better than putting it on for the whole time. So you can't, some anesthesiologists feel that that nitrous, a little bit of it will get the safety, to get the airway secured in a more safe manner. So you've got to kind of talk to them about that. It's all the dose of what we use.
Okay. So would prepping, let's say you're like, okay, 2-3 minutes nitrous or a little bit with the SIBO just to make sure. Is there a way to prep for that? Like, would giving doses of B12 2 weeks in advance, is there something you can do to kind of compensate for the fact that there's going to be some B12 depletion?
Well, that's why you need your DAN doctor, your MAPS doctor.
Right.
Every kid is different. You're going to have to go to him or her and discuss on ways. You want to support the metabolic pathways. You want to support the mitochondrial pathways, the detox pathways, the methylation pathways. So you support all those before, you support all those after. And then you kind of, after the surgery, you're going to have to support those pathways again, and then find out what's the best thing for a cleanup. Every kid is different. You may use charcoal or Pectosol or Berber. That's the best. The best thing to do before you undergo an anesthetic is to have an appointment with your DAN doctor, and see what works for your kids. Every kid is going to be different in the support of all these pathways.
Some of these kids end up taking a boatload of meds afterwards. My kid, I think, was on codeine afterwards, and they need medications a lot of times because afterwards they're going to be in pain and there needs to be something to help them out. And do you have any advice or thoughts about that?
Well, as you know, if you have a kid that's going to have pain, you need to give them some pain relief. That is going to, the whole thing about anesthesia is that you've got to prevent the sympathetic response to pain, okay? Because our kids are sympathetic anyway. You can't, you have to prevent that response. So if they need pain medicine, you have to give them pain medicine. Another thing that they like to give a lot is Tylenol. It's the biggest pain.
And codeine often has Tylenol,
Right,
acetaminophen. It's
right,
yeah.
right.
Okay.
So we all know that our kids are low in glutathione, and then we give them this Tylenol, and it depletes their glutathione even further. So the thing that you have to do is that you have to go and you have to talk to the anesthesiologist and talk to your doctor if you're having surgery, and tell them your concerns about Tylenol. Another one that you could get is use ibuprofen instead, okay? But ibuprofen also has its risk also. So this is something that you need to talk with your anesthesiologist after, or your doctor after, about pain medicines, and tell them about your concern about Tylenol. Some parents bring their own ibuprofen. A lot of us have ibuprofen that we get formulated that doesn't have any dyes and preservatives in it. Okay,
Compounded, sure.
right, compounded stuff. Because a lot of our kids are very sensitive to the dyes and preservatives in the regular Tylenol.
Yeah,
okay,
absolutely.
so this is something that you have to talk to them about. Tylenol is a big one, and this is something that you need to discuss with your doctor after.
What else do we? I mean, there's such a big issue. We could sit here, I think, all day, and I feel like we're almost, kind of giving an overview here. I feel like we could take any one of these topics or issues and really, really break it down. But basically, I hear what you're saying, that our kids have some major concerns here. You have to know how to talk to your doctor about that, how to talk to the anesthesiologist or anesthetist.
Right. Well, here, let's get better.
Did you hear me say that? Anesthetist.
Getting better. Getting better. Well, look, why don't we just, I pulled up one of my slides, okay? So, you need to go and discuss with your anesthesiologist. You need any specific, medical or metabolic problems concerning your child. So you have to talk to them about, hey, my kid has a bad gut, he's got chronic constipation, all those things. If he has any genetic problems, if he has the MTHFR, which is important in methylation, even there's stuff out there in the media, in studies that show even links to MTHFR and colon cancer, MTHFR and breast cancer. This whole 23andMe and whole looking at genetics, a lot more people are looking at that. So that's a valid concern if your kid has a CBS or something like that. So that's another thing you need to discuss with them, because the CBS will impact your detoxification pathways.
CBS, tell them what that stands for, because some people may go, what is she talking about, CBS?
Cysto.
Oops. Is it a blood?
It's basically it's the pathway that is in the glutathione pathway to make glutathione. Cysto beta-thione synthase. I'm sorry.
So if you said CBS to a doctor,
God, I'm brain dead this morning. You made me get too early.
If you said CBS to a doctor, would they know what you're talking about?
Hopefully, yes.
Okay.
Yes.
All right.
Yes.
CBS.
Right.
Maybe I'll put it on the bottom of the screen.
Our kids are doing the metabolic pathways. They've had YASCO and things like that. The CBS enzyme is very important. It goes from that pathway that makes glutathione. Okay.
Glutathione. I'm gonna
and that's basically a sulfur problem. Okay. So if you talk to them about genetics, you want to talk to them about methylation problems. If your kid has been tested for low B12 or low folate, there's a lot of stuff with Dr. Fry and Dr. Rossignol. A lot of our kids have gotten tested for cerebral folate deficiency. So that's another thing to bring up with them. Any kind of mitochondrial issues. Lots of our children have been diagnosed with complex 1. Okay. So there's lots of information out there that Dr. Rossignol and Dr. Fry have put out on the internet on mitochondrial dysfunction.
Sym,
you want to?
Oh, sorry. Okay. No, finish your thought, because I have a different thought and it might spin us a different way. So finish what you're saying.
Okay. You want to talk to them about your concern of nitrous oxide, okay, and that your kid does have a B12 deficiency, and you're concerned about using it. A lot of people, we've gotten away from using nitrous oxide, mainly because of nausea and mainly because of this mainly because of the methylation problems. But when we were taught in school, we were taught to give nitrous during induction and use nitrous during the case. And a lot of people have gotten away from that. But I think you need to talk to them about your concern with nitrous oxide. And I think they'll be very receptive to that. You need to discuss with them any kind of medications your child is on, any kind of allergies that they have, and even some of the supplements that you take. Just like any other surgery, if you're on fish oils, you need to kind of get off of those for a while. And this is stuff that you need to talk with your surgeon and your anesthesiologist. Okay. And then it's always good to call the anesthesia department pre-op and kind of talk to them. So it's not so rushed in the morning and you're so nervous. And a lot of them, really will talk to you, and they're very, they'll be very open to your concerns.
Yeah. And just in our experience, I spoke with you directly about my son's upcoming dental procedure and took your advice. I had a phone call with my anesthesiologist, his anesthesiologist, a week before, and I was very comfortable speaking to her about all of these things and discussing it with her, and things went very smoothly. And so I'm just saying that as a point to say that a lot of these people are willing and open and available. Yes, there will be some who maybe aren't as friendly as others, but a lot of them are great.
Yeah, and I mean, if this, the anesthesiologists want, that's one thing one thing about anesthesia is that it is very specialized. It's very, everybody. You have to realize anesthesia is not just cookie cutter. It's individualized to each patient. Okay.
Let me repeat that because
it's
you
not,
broke up. Let me repeat that real quick, Sym. Hang on, because you broke up. Sym just said that it's very individualized to each patient. There's not just like a recipe that they can give.
Right. Right. And that's what people have to understand, even as moms, it's a very individualized protocol. So, you can have one case and five different anesthesia people can do it five different ways differently. And everybody has their own way that they're comfortable with and what they think. And so that's why it's very important to talk with the doctors about your concerns with these pathways, because they understand. I mean, there's articles out there that tell you how to take care of patients with mitochondrial dysfunction. There's articles telling you how to take care of patients with the MTHFR, and problems. And it is cystathione beta synthase is the CBS.
Spell that 5 times fast. No. Okay. Quickly, Sym, what about just adults? Like, I'm a mom and I'm watching this and I'm thinking, oh geez, I've got to have surgery in 2 months, and I'm a little bit concerned here about my B12 levels maybe, and is it enough to go in and I guess say these are the concerns that I have about me? Is there any advice for adults?
Right. I mean, a lot of us have, unfortunately, a lot of us have the same problems that our kids have. And what's really funny is I just read something in the media about mitochondrial dysfunction is being diagnosed at any age. So, yeah, we have the same problems as our kids and the same genetics as our kids.
So we should have the same concerns.
Right. And yeah, if you go in there and just, say, hey, look, my kid has problems detoxing. I may have problems detoxing. Just keep it simple. And, you can just, if you have the same problems as your kids, you can say that too.
Okay.
I mean, our we have, we're basically not as frail as our kids, but some of our moms are. Okay?
And as we get older, maybe we're getting a little more frail.
Yeah, true.
Some
true.
of us, yeah.
So if, it's easy to get tested on yourself. I mean, a lot of the moms are sick, just as sick as the kids. So as we always say, you've got to work on yourself and your kids too.
Yeah. Just FYI, I ended up Lance's second surgery, which went very well. They used Sevo and Versed, and it was flying colors. It was night and day. The story of his story is in the book. Buy the book, Thinking Mom's Revolution, page 175 text. There's our story in there, written as a stage play. But I talk about, how awful that first surgery was, and the constipation and digging poop, literally rocks out of his butt, and the crying and it was just awful the first time. And the second time, it was night and day. It was like nothing had happened. He just woke up and it was just all fine and groovy, and my jaw was on the ground. The difference. So thank you from the bottom of my heart for that. Oh dear, I'm tearing up, Sym. I love you.
I mean, what we need to do is that I hope that, this will open the communication between our concerns and the anesthesiologist, because we need to get a good language going, a good conversation going,
Well,
and we
hopefully
have
this will be the start. Here you are, an anesthesiologist, and I'm an autism. Not, no, you're an anesthetist nurse. But we're having a conversation, and other people are watching this, and they will have conversations, and there will be more and more conversations.
right.
That's
Well,
the
I
goal.
mean, the good part about it is that, as I told you before, they did come out with a study about 2 years ago saying that nobody's studying this, and they decided that
We did
article.
a study to say nobody's studying.
Yeah, well, I wrote, Terry Arenga asked me to write an article a couple years ago when they had
Let's talk about that.
a
Yeah.
child, and it was in you know, I wrote this article, and it's just there's a lot more things that I've learned since that article. So I'm going to try to write another article or put something else up to kind of update that.
Okay.
But our community is looking at that.
Okay.
They have a recent study that just came out, the British Journal of Anesthesiology. I have not been able to get it yet. I'm still in the process of trying to get it. It came out in January. I have no idea what it is about.
Okay. Well, when we have
It's
that
about
again,
anesthesia and putting autistic kids to sleep. So I don't know what the concerns are.
well, when
And
that
there's
comes out, we'll link that up too and
yeah,
share that on Facebook and get some hype about that when we see what it says.
right. So I mean, I think everybody is looking at chemical exposures in every different aspect of our lives. I mean, come on, it's we have a society that's so sick, and a lot of it is environmental. So I really think that we have a lot of anesthesiologists out there who have autistic kids, and hopefully they will take the leads and start looking at this a little bit more too.
Okay.
So
Yay. Well, okay. So thanks for chatting with me. I love you to bits. Yeah, I literally get teary-eyed talking about, the difference between his two surgeries, and I credit all of that to you. So yes, I have a little hero worship for you. I get starry-eyed when you're around. At Autism One, everybody's excited about seeing, you know, Jenny McCarthy or whatever, and where's Sym Rankin? That's my question. Anyway, so thank you for spending time with me and doing this, because I just think it's such a huge, important topic. We will have your slides, PDF slides, up on thinkingmomsrevolution.com hopefully in a week or two. The sooner the better, because I know lots of moms will have more questions and want some more details, and the slides are more detailed than this. We will share your new paper when that's written. Absolutely,
okay.
we'll make sure that
Yeah.
that all gets shared across and around everywhere. The first paper, though, Anesthesia and Autism, that you wrote for Terry, and it's up on the ARI website too. And I'll put a link down here. There should be, and typing a link or something that people. That is also good, though, just to read and get some basic background on. And when this goes up on the blog, if you look at the blog web page, you will see links to some of the studies that we've been referencing, so you guys can start doing some research on your own. And you can find me on Facebook, Talia Segalink. It's spelled like Thalia. Seg. There's an egg in the middle and a link at the end. Oh wait, no, or Talia Michelle. Sometimes it's just Talia Michelle, because Segalink is so difficult. So Talia Michelle, Thalia Michelle. You can find me on Think Mom's Revolution, the Facebook page, like that, all of that. Anything major, I can get questions to you, right? I can always ask you questions if somebody comes up with something that's out of the ordinary.
Mhm.
Yeah. Okay, Sym, thanks for being here.
Okay,
Thanks
well,
for thinking out
thank
loud
you.
for me, with me.
Thank you. You're going to be going to my old home next month.
That's right. I'm going on a book tour to New Orleans, Baton Rouge, Louisiana area, because I'm going to be talking about the book, Thinking Mom's Revolution, that everybody should buy.
We used to live in Mandeville.
That's
and
right. I'll be in Mandeville.
Too. So I'm going to make sure all my friends get to you.
good.
So
Yeah,
you have
yeah,
a lot of people coming up to you.
Yeah. I'll be reading from it, page 175. I'll be acting out my little plaything there. Yay. Okay, we're a fan of your work. We're a fan of you. Thanks for being here today, thinking out loud with me. And thanks to everybody watching this. Let me know if you guys have questions. Comment on the blog. We'll try to do our best to field this stuff. And good luck to everyone out there. Thanks.
Okay. Bye.